Today we learn about the tooth anatomy from the basics. There are 4 types of teeth: incisor, canines, premolar, molars. Firstly, we need to clear the concept that the side of the tooth towards the midline is mesial and away from the midline is distal. We have to learn all teeth from 5 views or aspects. First, labial or the buccal. Second, lingual or the palatal. Third, mesial. Fourth, distal. And fifth is incisal view. But today our all focus is on maxillary central incisor. We learned central incisor from the all views. Labial view. Vertically, the labial view divided into mesial, middle, distal. And horizontally, it is divided into cervical, middle, incisal. When one side of tooth meets to second side, it makes line angle. So when incisal ridge meets to proximal side, it makes sharp or 90-degree mesio-incisal angle and rounded disto-incisal angle. There are 2 developmental depressions on the labial aspect which divide the tooth into 3 lobes: mesiofacial lobe, distofacial lobe, centrofacial lobe. And 3 rounded protuberance are also found, which is known as mammelons. And shape of the buccal aspect of incisor is trapezoid. That is narrow at the cervical and wider at the incisal end. Now the lingual view. There is a convex protuberance at the cervical side which is known as cingulum, and 2 elevated borders or ridges known as mesial marginal ridge and distal marginal ridge. And also there is a developmental depression which is known as lingual fossa. Now there is an incisal view or the view from the top of the tooth. This is the mesial side, distal side, facial side, and the lingual side. There is a ridge which is perpendicular to the long axis of a tooth known as incisal ridge. Now we read about the proximal view, which is used for collectively both mesial and the distal view. Both are approximately same, but there is a little difference. Number 1. The cervical curvature is more deeper on mesial side than the distal side. Second, contact area. The contact area of the mesial is more towards the incisal side and of the distal is more towards the cervical side. And the third difference is that the incisal edge can be seen from the distal side but can't seen from the mesial side. Thank you for your support.